Backache is a common condition among our individuals, irrespective of age. It can affect younger age, middle or elderly people with different causes. If we say certain conditions, majority can be managed with medication and physiotherapy and other means, but certain conditions we have to go for surgical procedures. Until now, we have been doing with open procedures. That is, we have to make a big incision and open the spinal part and do the surgeries. But currently, we have a new technique. It has been used in other countries widely. Now we have introduced to Sri Lanka. There is a full endoscopic spinal surgeries. So this is a new procedure we have introduced to Sri Lankan setup. Good news is it can be done without full anesthesia. It can be done with a local or regional anesthesia. So as it is introduced now, we have to select the patient. We can't do endoscopic procedures for all surgeries, but for selected cases, we can do endoscopy to pass instrument into the disc, and then we can do the discectomy. That means the removal of the prolapsed disc can be removed very safely by this method. Also, this method is available for spinal fusion. That is, when there is a condition called instability, the spine is moving and it causes pain when the patient is in the standing or sitting position or in certain movements. With the investigation, if we find there is instability in the spine, it can be fused with screws and other means of cages. So that can be done. So now we are entering a new era of spinal surgery procedure using a monoportal, that is only single hole. Through that we pass the endoscope and do the necessary surgical procedure. This is a new technique introduced in Sri Lanka. So we did all the investigations, necessary x-rays and MRI scan, and we plan to perform a surgery using minimally invasive procedure. That means we didn't want to make any big incision, and we used the endoscopic camera. We entered the affected part of the spine. We released the compression of the nerve root as well as the spinal cord, and the patient was able to move her limb immediately after the surgery. We made her to walk and she went home happily without any complications. In this procedure, when we are using endoscopic procedure, we are continuously irrigating the surgical field with saline. So it is recorded, it is proved that infection is 0%. There is totally no infection by doing this procedure, and it is available in Sri Lanka. Now we have started doing these procedures in our setup for spinal surgeries.